Okay. Good day, everyone. This moment, I've brought an important topic to us, and it's about physiotherapy and the roles they play in the neuro rehabilitation. So, with me here, I have a specialist neurophysiotherapist from the University Hospital in the UK, and he's been a physiotherapist for some years, and he has practiced both in Nigeria and here in the UK. He's going to be sharing some experiences that he has gathered from the years of his practice. So the topic before us, physiotherapist role and specialty in the UK and that of Nigeria. Here with me is Mr. Wasiu Afolabi. Can we meet you, sir?
Yeah, thank you very much. Good evening. Thank you for having me today. It's been a wonderful time being here today, this evening. The anchor mentioned, my name is Wasiu Afolabi. I'm a specialist neurophysiotherapist from the University Hospital Lewisham here in London. Yeah. Thank you very much. Yeah.
Okay. So quickly, there has been some rumor about neurophysiotherapy practice in the UK and compared to what is being practiced in Nigeria. Can you share insights into the key differences between the role of a neurophysiotherapist in the UK and Nigeria, and how these distinctions impact patient care?
All right. Yeah. Thank you very much. Firstly, I would like to start from trying to give us a bit of background about the education of physiotherapists from the Nigeria point of view compared to that of the UK. Um, uh, when we go back to the Nigeria point of view in terms of physiotherapy education, basically you have to study physiotherapy for a period of time. It used to be 5 years. I'm aware that now it's being moved to 6 years, whereby you have to undergo your preclinicals, where you undergo rigorous academic studies in the area of anatomy, biochemistry, pathology, physiology, and so on, and what have you. And also, you have to pass your medical board examination, of course, in some schools. Whereas in some other schools, you just have to, write your um, examination at the end of the semester, irrespective, and you have to pass anyways. And after that, you have to go for your clinicals, whereby you have to spend few years in the clinic, say 2 years, where you have to go through the core rotation of physiotherapy practices, and that involves neurophysiotherapy as well, involves cardiopulmonary physiotherapy, geriatrics, musculoskeletal, and so on and so forth. Then afterwards, before you can qualify fully as a physiotherapist in Nigeria, you have to go through your 1 year mandatory internship program, whereby you still go on rotation again, but under supervision of a qualified physiotherapist at this time. And afterwards, you have to go for your National Youth Service Corps, and thereafter you have to you can apply to start working as a fully fledged physiotherapist in the Nigeria point of view. Now let's come back to the UK context. What do we have? What obtains in the UK? So in the UK, basically, for you to qualify as a physiotherapist, you undergo a 3 year bachelor degree program, and after that, of course, the 3 years also involve your clinical placement, where you have to go to different hospitals to complete your clinical rotations. And of course you have to pass, and it's quite rigorous and intense. What I would just say briefly is that the practice in Nigeria compared to the UK in an holistic view is different in a way, because obviously the NHS has got their processes in terms of treatment of patients, in terms of discharge pathways, in terms of the organizational structural organization is quite different from what obtains in Nigeria. But when we look at the education, I must say boldly and confidently that the education of Nigeria's therapy undergraduate program is quite robust, and it's quite rigorous when you compare it to that of the UK system. However, when we try to bring evidence into practice, trying to bring the theoretical aspect of things into clinical practice, I mean, obviously we should know the UK has the best in that kind of area. I'm going to elaborate on that shortly when we get to areas where we talk on what exactly do we do as a neurophysiotherapist in the UK and as a neurophysiotherapist in Nigeria. Um, I will go on by talking about how do you become a neurophysiotherapist. Well, I appreciate that in the UK, a lot of there's a lot of awareness regarding specialization for physiotherapists comparison to Nigeria, whereby everyone knows that there are a lot of specialties that you can actually focus and specialize on in the UK when compared to Nigeria. For example, say we've got those specialization in Nigeria, but they are not well, developed, so to say, whereby you can boldly hone your ground in an area of specialty and claim the authority in that area. So, what am I saying in essence? In essence, is that when you specialize in a particular area of physiotherapy in the UK, you go through a kind of pathway that makes you a qualified specialist, so to say, in a way to make informed clinical decision towards the area which you have chosen to specialize in. For example, in Nigeria, to specialize, the traditional pathway is for you to, go through your postgraduate um, programs, maybe your master's degree programs in those areas of specialty. For example, I did my master's in neurology physiotherapy, and afterwards, traditionally you can just be in a specialty area. Just recently, we should appreciate the Association of Physiotherapists in Nigeria for going forth and back to, to advocate and, to enlighten the public about the specialties and moving program, bringing update programs forwards in order to, make it a kind of standardized structural program. I'm talking about the postgraduate college of physiotherapy, whereby the NSP are now advocating, to, bring people in to have specialized areas. Some people might argue with me that why do physiotherapy needs to specialize? These people could argue, we could have a lot of argument about why should you specialize as a physiotherapist? Why are you specializing? If we want to go back to the, to the antecedents, to the history of saying it's just a physiotherapist, you don't have to specialize. Why are you specializing? What's different? What are you doing differently when you say you're a neurophysio, and when you say you're an MSK physio, or when you say you're an orthopedic physiotherapist? Are there any other thing that you are actually doing that are different that makes you a kind of specialist in that area? Are you actually doing anything different at all? We're gonna see that tonight and see if
Oh,
actually there is a need
very good.
for physiotherapy
Very
to
good.
specialize.
Very good. Very good. Interesting. What a very big, robust foundation you've laid there. Quickly, if I may ask, in your experience
Yeah.
as a neurophysiotherapist in the UK, what would you say is the main challenge to the practice of physiotherapy in Nigeria?
Yeah, thank you very much for the question. Um, there's a lot of challenges facing the physiotherapy profession in Nigeria. I'm going to break this down into three diverse view or point of discourse. The first thing we'll look at in terms of legislature, like when we look at the government policy and the legislature of medical sector or the health sector in Nigeria, so to say. The health sector in Nigeria is, with apologies, it's kind of biased in a way, trying to focus on a particular group of people, and the voice of other people or other members of the health sector are kind of underrated in a way, just because everyone believes that the head of the medical sector is the medical doctor, and as a result of that, it's actually impairs other growth and development of other professions. I'll give a very good example about this. Just recently, I came across an online, um, uh, uh, online discussion talking about why some group of people should advance their program, and why some people are saying no, they don't have to advance it. They have to stay where they are, things like that. It's kind of very incredibly interesting and amazing to see how how divergence the health sector in Nigeria is, so to say, and you wonder if actually the care we provide is actually centered to the health of the patient. If everyone comes together and we say we are actually coming together to work collaboratively for our patients, then I think a positive thinking should be having a kind of positive advancement in the way we practice, I mean, our profession. I mean, in general, I'm talking about every other health profession this time around. So, I mean, if I see an health profession advancing, I should be able to appreciate the advancement the profession has brought to the health system, in as much as it's mainly to focus on adequate and quality patient delivery. I mean, I should have this kind of, should I say, this kind of um preconceived idea about an advancement in the profession in the health sector. So I'll talk about legislature. I mean, the legislature in Nigeria is, however, not not helping the growth of physiotherapy profession, so to say. And what do I mean by that? For example, in the UK here, there are legislatures that makes physiotherapy boldly visible amongst the multidisciplinary team of professionals, because I mean, obviously it's a protected title and you've got several branches or several skills that you could actually acquire, and these skills are packed with legislature that can make you to practice them. I mean, I'll
Okay.
give you a very good example. For example, in neurology, I mean, as a physiotherapist, when you go for your injection therapy training, you can actually, I mean, treat patients with focus spasticity using the Botox injection, and these are things you cannot do in Nigeria, even when you have the skills and qualification to do so because of the legislation issue. Another thing I'll talk about is in terms of service delivery and remuneration. When we look at the Nigeria system, there is a kind of wide parity in pay for health professionals, and this is actually something we need to look into, because if we want to argue that the wide margin disparity in pay should be because of service delivery, then we should find a way to evaluate these services that each professionals provides. I mean, I understand the Council of Establishment sometimes said the wide margin in parity is due to the number of years of study. I mean, this should not be the case, because if we actually want people to deliver a very huge quality service delivery, then we should evaluate the service those people provide. We should audit their service provision and see why are they providing the services, and remunerate them according to the service they provide. So this is another aspect of another issue that's facing the growth of physiotherapy in Nigeria. The next thing I'll talk about is awareness, population, and the public acceptance. It's kind of unfortunately that in Nigeria the physiotherapy profession is growing, is developing, but the public awareness is still not enough for physiotherapists to actually own their ground. I mean, we see a lot of people going around parading themselves as physiotherapists. We see all these local herbal companies. For example, we've got so many of them. They go around going with several machines to people houses, to people jobs, and they say, oh, I can help you diagnose a certain disease in your body using this machine. I mean, I remember sometimes ago we used to have people going around carrying some kind of slippers, and they tell people to jump on the slippers, just provide some kind of massage to them. I mean, these are the issues facing the growth of therapy profession in Nigeria. I mean, I'll just
Oh,
limit it to those three for now,
wonderful.
and we can come back to
Wonderful,
this one.
wonderful, wondering. It is very, very interesting, I must say. Those 3 points you've highlighted they appear simple, but very, very, very important.
Yeah.
And it has been three main factors that I would say has been limiting the growth of the profession. Let's proceed. Uh, Being a physiotherapist in the UK, what uh, are the specific advancements or technologies in the UK that enhance neurophysiotherapy practices as
Okay.
compared to what we have in Nigeria?
Yeah. Thank you very much for that question. For the context of my audience, I would like just to brief what the neurophysiotherapist actually does. What conditions do they see? So when you hear people having a stroke, I mean, the first point of contact is talking about how they want to use their, I mean, lost part of the body, how they want to be able to, use their hand to perform those functions they have been performing previously before they had a stroke. I mean, you agree with me that a large number of population of people that had stroke are middle age, between the age of 30 to 65 years of age, and these people are still active member of the society. There are people that still need, they need to work to fend their family, they need to, go about their day-to-day activities. So how do we make these people, I mean, go back to their usual activities even when they've had a stroke? I mean, having a stroke should not be a death sentence, so to say. It shouldn't be something like, oh, I've had a stroke, then my life is ruined or my life is finished. You know what I mean? So I mean, it's something that we could actually look into, and how do we want to reintegrate these people back into the community and make them function like a normal human being. So just to mention that, part of what we also do as neurophysiotherapists is looking at people that have sequelae of neurological conditions. And you can talk about Parkinson's disease, you can talk about spinal cord injury, you can talk about Bell's palsy, you can talk about, I mean, it's very wide. There's a wide range of medical conditions that are amenable to the physiotherapy practices. And why is physiotherapy important in the management of neurological conditions? Just like I mentioned earlier, a lot of functions that we carry out with our hands, with our legs, are from the brain. And if the brain has suffered neurological injury, then definitely we should expect a resultant effect from those aspects of our body that, that are connected to the brain. So it boils down on the physiotherapist, the neurophysio, to use his skills, his advanced skills of quality assessment and plan of treatment to actually give the patient the best therapeutic outcome. Just to mention that. And what are the advancements, the technological advancements that we have here in the UK that we use, in bringing our patient back to function? Okay, so the first thing I would like to say that the largest power or the largest tool that the neurophysiotherapy have in the UK is advancement in skills. There are a lot of skills updates for the neurophysiotherapists. This has enabled them to, to giving their best to their patient. I'll give a very good example. A very good example is talking about the use of the bodyweight support system in Gates re-education program. I mean, these are things that you don't get to see often or very readily available when you talk about the Nigeria context. And these are things that can actually foster, quick recovery of patients when they are on admission. And that's just a brief example. Another example is talking about things like talking about giving patients, talking about extensive management of spasticity that comes down with stroke. We have diverse skills. For example, just recently I was discussing with someone the recent update in management of spasticity. Now we are talking about neurocryolysis. Cryoneolysis is a new advancement in the management of spasticity. So I mean, these are things that are obtainable in the in this aspect of the world that makes rehabilitation very robust and very very intensive in management. There are a lot of things that I cannot start to mention now just for the sake of our time, but when the question comes in, we can actually look at them
Yeah,
and see how we can
yeah.
discuss about
Interesting.
it. Yeah.
Interesting. Because of our time, I would have loved you to throw more light on the neurocryolysis, but I will leave that for now. And there's something that bothers me in terms of participation in physiotherapy program. May I ask, what do you see, or how do cultural attitudes towards healthcare in the UK and Nigeria influence patient engagement and adherence to physiotherapy program?
Yeah, thank you very much. I understand the context of your question. I mean, it's quite unfortunate again that Nigeria are a group of people with diverse cultural beliefs, and I mean, when I say cultural beliefs, I'm talking about religious belief, local beliefs. For example, I'll give you a very direct example from experience. I've had to, manage a patient who had stroke in the past, and this particular patient believed that this stroke was spiritual, and because of that they never sought for any medical attention. That's one of the issues we face in Nigeria. Another thing we face in Nigeria is the late presentation to the hospital. You see a lot of patients not even being referred to physiotherapy at all when they have even had a stroke. I mean, it's quite, it's very funny that a patient has had a stroke and they've not been referred to a physiotherapist. And now that is when we are approaching about the first contact physiotherapy practices, whereby the patient can have access, direct access to the physiotherapist without any form of referral prior to their presentation. I mean, you will agree with me, and I appreciate that in the UK, the physiotherapists are well developed in the sense that they have updated skills when you talk about managing patient medical condition and bringing evidence into practice. I mean, this is not to say therapists in Nigeria have not had updated skills, but like I mentioned earlier, the kind of legislation that limits the scope of practice of physiotherapy is quite unfortunate, and this in turn, I mean, affect the public at large because I mean, a lot of people have been denied the opportunity for direct access to physiotherapy services. I'll give you a very good example. A patient who has had say an MCA stroke or a middle cerebral artery stroke, for example, and the patient has come down with dysphagia. I mean, this patient, because he has come down with dysphagia, might be at risk of coming down with what we call aspiration or aspiration pneumonia. Maybe when they drink or maybe when they have food in their mouth, things like that. I mean, there is a need for a specialized speech and language therapist, to be involved in the management of such a patient. I mean, so it's quite unfortunate that this group of people are not even readily available in Nigeria context, if you know what I mean. So it makes
Yeah.
the management very, very difficult. And because of this, the patient has to suffer at the expense, of the lack of professionals that we need in that kind of context. So what I'm saying in essence is the cultural beliefs have a huge impact on the recovery of patients when we come to neurological condition. I remember recently I had a call from a student in Australia who is a PhD student. He called me from Australia and he was actually working on cultural adaptation and outcome outcome of interventions on in West African countries. Then he called me and he was asking about Nigeria. I mean, he was working on spinal cord injury. Then he was asking me that what can I tell him about the incidence of spinal cord injury in Nigeria. I mean, the prevalence of spinal cord injury in Nigeria and the management. How has the cultural belief affected the management? Then I mean, to start from the very basic things, talking of basic amenities, these are risk factors that make people get prone to having sequelae of road traffic accident or road traffic injury that predisposes them to having neurological problems. So I mean, even in the
Mm.
Nigeria context, a lot of people walk about with undiagnosed medical conditions, for example, hypertension. A lot of people are very hypertensive, they don't even know they are. So it's very unfortunate that people do not pay much attention to their health just because they've got a lot of things going on in their lives that make them to not even have the slightest of clue about what's going on in their system. I remember I used to
Mm.
have a patient who was incredibly hypertensive and she never knew she was actually hypertensive. And this patient came to the hospital in the morning, just to drop a friend off. And in the afternoon, she was back as a patient herself. Why? Because, she was just walking down the mall and she had a stroke just on the road and she was back to the hospital. I mean, it goes to tell us about how having a proper awareness about the cause of the basic things that could cause stroke in the first place. I mean, 80% of stroke cases are caused by hypertensive crisis when people are hypertensive and they are not medically compliant with medications,
Yeah.
so they come down with with various form of stroke. So these are kind of things that affect the Nigeria system as a whole.
Awesome.
Yeah,
Awesome.
thank
Awesome. Awesome. Culture has played a very, very significant role in healthcare
you.
as a sector, both
Yeah.
home and away, and the culture itself mixed with religion in Africa. So religion and culture has been a great hindrance to accessing proper healthcare amongst our people. That I must say, because I remember vividly, I used to have a patient then that never knew he had uh, hypertension until he was a pastor, until my microphone started dropping off in his grip while preaching on the pulpit. So it dropped once. he thought it was the devil that was trying to stop him from preaching or minister to the people. He picked up
Yeah.
the mic again and he started speaking in tongue, kabashing, trying
Hmm.
to scare away the devil that was trying to drag the mic with him. Unfortunately for him, he was finally knocked down by stroke
Hmm.
and he became a patient. Then he had to go through counseling and was made known that that wasn't a devil, but he had hypertension that was not diagnosed and untreated. So he was later presented with stroke. So that's goes to say our culture, religion has been a big hindrance in Africa as a whole, and
Hmm.
specifically Nigeria. That being said, I would love to ask you a very, very personal question. And the question will be, in your practice, have you experienced any cultural misunderstanding or a moment while practicing neurophysiotherapy in in the UK?
Hmm. Yeah, thank you very much. Yeah, the question is a bit tricky because it's something I need to reflect back onto and see when and how I've experienced this. I mean, in one way or the other. I mean, it's very important that we mention this as well, just because it might be helpful to some people listening to us tonight. And I mean, coming to the UK from Nigeria, having been practicing in Nigeria for quite a while, I mean, you should expect that you will definitely meet some, some cultural changes that might affect your effectiveness at work. What am I saying in essence? What I'm saying is, you might come to this kind of setting and you feel kind of intimidated with the group of people you have to work with, and this makes you, in a way, it makes you feel, I mean, it makes you feel a kind of should I say, not confident enough to actually express what actually what I remember. I mean, coming down here, I had to face a lot of challenges. To be honest, in the sense that you have to be able to prove your worth. You have to be able to prove, I mean, what knowledge you've got and what skills you've got. I mean, the lack of being able to prove your skills would amount to you being termed as being incompetent. So you have to have a means of trying to maintain the decorum within the team. So what do I mean by this? The first thing you have to do, I mean, what worked for me is that I was able to study the team firstly, and I knew where I needed to come in and when I needed not to come in. I mean, you might experience some kind of microaggressions from people, and this might be overtly or covertly. It might even be non-verbal, like they don't say it to you directly, but I mean, it's something you just have to, live with and know how to challenge those kind of inappropriate behaviors. I mean, you should be able to challenge an inappropriate behavior when you see one, and I mean, respectfully challenging them is what I mean, not causing a kind of havoc or causing a kind of disruption in the service delivery. For example, I'll give an example. You've had somebody saying to you, "Oh, why are you talking, you black sheep," something like that. I mean, you should respectfully let this person know that this is an inappropriate behavior, and you will not appreciate if the person says that to you the next time. I mean, these are basic things one has to be able to stand for and try to defend, because actually, if not you, it might be someone else. So then you have to maintain that kind of tradition of trying to stand tall towards challenging inappropriate behavior. I mean, we appreciate the fact that coming down to the UK or coming down to anywhere in the world apart from your hometown is quite different. I mean, an environment where you are used to is definitely different from where you are not used to. So I mean, it's just kind of a normal kind of thing that people might be acceptive and they might be receptive to you. I mean, people are kind of different. I mean, this does not define the entire population of people in the UK, if you know what I
Yeah,
mean. It does not define what they stand for or what their value is. People are just different. I mean, each person is an individual entity on their own that have their own perception or their own point of view of how they look at things holistically.
so
So I mean, we should not use that as a yardstick to to categorize. I mean, everyone in the UK. Yeah.
very good. Very good. I get your point there. I exactly understand what you are driving at, and if I may ask you, what do you see to patient interaction? How are you able to interact well with patients in the UK compared to how you would interact with patients in Nigeria?
All right. Yeah, thank you very much for the question. First of all, I must stress that the NHS process or the NHS hospitals are kind of embedded in what we call clinical governance. What do I mean by that? Clinical governance are a set of frameworks that NHS organizations that they are responsible for providing continual service delivery and ensuring an environment where evidence-based practices will flourish. And part of these pillars of clinical governance is patient and public involvement. That's where I'm going. And if you look at the process of the NHS, it's more patient centered in the sense that you want to give the patient what matters to them and not what matters to you as a clinician. I'll give you a very good example of this. In the Nigeria context, for example, when patients have been admitted into the hospital, they are at the mercy of, so to say, the consultant who claims to be the owner of the patient, if you know what I mean. And the patient dare not talk when the consultant when they are in presence, for example, when they are in the ward round, just because they feel this is my savior, this is somebody that is gonna save me from my predicament at this time, and the patient's voices are not being heard in a way, to be honest. But when you come back to the UK setting, you see that the patient had the center of care, the patient is the major reason why you're at work, then definitely you have to give the patient the best quality treatment that they deserve. So we talk about what matters most to patients in the context of bridges, looking at what the patient actually wants and not what you want as a clinician. You might identify a goal for a patient, right? But the goals has to be a kind of patient collaborative goals that has to be understandable and realistic to the patient themselves, and not what you feel as a clinician. For example, I'll give you a certain example. You could diagnose a patient of maybe say simple migraine, and you say, "Oh, I'm going to give you paracetamol." I mean, your patient has the freedom to say, "I'm sorry, doctor, I'm not going to take that paracetamol from you just because I don't feel like using it." I mean, you don't have anything, you don't have any choice than to look for an alternative to the patient for what they can use, or you dismiss them. I mean, you don't have the sole authority to enforce your treatment on your patient, if you know what I mean. So it's more robust in terms of patient-centered care. To be honest, we need to appreciate some centers in Nigeria who have been practicing this kind of collaborative, patient-centered collaborative approaches. For example, I'll mention the Federal Medical Center in Abeokuta. I mean, they've done so much well in this regard by trying to, making sure that the patient is at the center of their care. So, I mean, this goes down to talk about a lot of things, but I mean, this might not be relevant for the purpose of this discussion. I mean, when we talk about discharge pathways, I mean, it goes a long way to talk about how the patients are made to be the king in the context of treatment in healthcare
Yeah,
sector in the UK.
Y-
But I
you
mean,
know, you know
yeah,
that this pathway you just mentioned
yeah,
was one of the things I struggle with when I begin to practice in the UK.
yeah,
Back home in Nigeria, there's nothing like discharge pathway.
yeah,
In fact, we don't have plan for discharge.
yeah.
Once you are fine as a patient, go home. Your
Mm,
relative, your family are there to pick you up.
mm,
So there's nothing like intermediate care within the Nigerian context. Once you are fine and or once you have been deemed medically fit in quotes, then you are fine to go home
yeah.
wherever you're coming from. Then the family step in. Then you either continue as an outpatient or you just choose to remain home.
And this is one advocacy that I feel the Nigerian rehabilitation professionals can actually make as a point of as a key focus, or an area where they can, shine their light and actually preach the gospel of what they are actually trained to do. For example, I'm talking about the occupational therapists and the physiotherapists in this context. I mean, looking at Nigeria context, for example, the occupational therapists have a very tiny, space to perform, because even the role of their job are not well, defined within the public space. I mean, these are areas we can key into and put more effort to focus on in terms of health coverage for public health services delivery. I mean, if you look at, for example, we're talking about this chapter way, and these are things that add to the number of hospital readmission in Nigeria, because if someone goes home with a very high risk of fall, and in the next 2 3 months the person has had about 3 4 falls, apart from the fact that this person could have some other musculoskeletal injuries from the fall, I mean, they could develop neurological issues that will result into another readmission as a way. I mean, there are a lot of things embedded in
I
these things.
get you. I get you.
Yeah.
But again, how frequent do we have falls in Nigeria? Falls hasn't been a great concern back home in Nigeria because I don't think we have much people presenting with falls in our hospitals.
Well, to
And
be honest, I
reason,
think a lot of fall cases in Nigeria are being underreported. They are not reported because why? Because
yes,
we don't see fall as a kind of medical condition or a medical emergency in Nigeria. We see fall as a normal thing. Even somebody goes out, to the mall or to the field or something like that, they have had a fall and they feel it's just a normal thing for them to have. I mean, you could have had a fall and have a mild internal bleeding to your brain. I mean,
yeah,
you wouldn't be able to tell, and this could
yeah.
even manifest months later as a neurological issue for you. I mean, if you know
Yeah.
what I mean. So it's just so unfortunate. Yeah.
So that's again points light to culture, tradition, and way of life of our people,
Yeah.
and the concept of family system has also been it has been helpful, I would say, and
Mm,
also at the same time has been an hindrance to the reportage of falls.
mm,
So, having said that, without wasting our time, I really want you to think deeply. What do you think is the future of neurophysiotherapy in the UK?
mm.
In the UK.
Yeah, that's a very good question. The international conference for the Neuro-Physiotherapists will be coming up next year, May, at the Radisson Hotel here in Heathrow, London, and it has been anticipated that a lot of specialist neurophysiotherapists will be joining us, to engage in this program. Talking about the future of neurophysiotherapists in the UK, I can say the future is really very very bright. I mean, the future is now because a lot of things, a lot of advancement have been happening. I mean, for example, talking about visual reality therapy, when you talk about using visual reality to improve neurological conditions, talking about, I mean, there are a lot of things coming on in terms of looking at technology in cooperation with neurophysiotherapy, for example, talking about the use of myoelectric hand for patients who have, I mean, there are a lot of things talking about vegan nerve stimulation to restoration of upper limb functioning. I mean, there are a lot of advancement coming up now that makes it kind of reassuring that the future
Mm,
of neurological conditions will be very, very, very great. I mean, we
awesome.
would get to a situation or a point in time whereby people that have a stroke would go home, say within 3 days, even, I mean, within
Awesome.
within 2 days, just
Amazing.
because the advancement level of how quick we could make a certain diagnosis, how quick we could intervene in terms of getting them to restoration of function. I mean, these are
Amazing.
things we are looking out for in the nearest future. Yeah, I would also
Awesome.
say the future of neurophysiotherapy in Nigeria is also
Good.
bright, because if you agree with me that I mean, the profession in Nigeria is advancing with new changing curriculum for undergraduate programs, whereby they've got a lot more, I mean, robust curriculum that would make them to stand tall as an autonomous independent practitioner. And
Awesome.
I mean, yeah, I believe the future is bright.
Awesome. Interesting. Thank you very much, Mr. Afolabi. Again, for those who are just joining us or will be opportune to listen to this, I've been speaking with Mr. Afolabi Wasiu, who is a neurophysiotherapist in the UK, and he's been talking about the role of physiotherapists in Nigeria and the UK. Specifically, he's trying to he should be speaking about neurophysiotherapy, but he has done also good by having a kind of overview, giving us general overview of prospects and challenges that are being faced by physiotherapists as well as the people of Nigeria, and how robust the physiotherapy practice is in the UK. So, without wasting our time, so that we'll wrap up this conversation, and I will ask again, finally, in a light-hearted showdown, if the UK and Nigeria were to compete in the physiotherapy Olympics, which country do you think would take home the gold and why?
Yeah, thank you very much for that question. Like I mentioned earlier at the beginning of the program, I mean, to be fair on Nigeria educational system, the educational system in Nigeria is quite robust and is quite, is quite intensive in the sense that it equips undergraduate students with the ingredient, with the key arsenals that they require, to actually face the labor market and outshine and outstand in terms of competing with people. But that's not to say the Nigeria has got the best of of practices or the best of skills. But then, like I mentioned, comparing the practices in Nigeria to that of UK is would be unfair on Nigeria again because it will be a kind of uh, uh, unfair comparison because a lot of factors has affected the process of physiotherapy in Nigeria, and those factors are things I've mentioned earlier in the course of this program. I would probably say to compare physiotherapy in Nigeria to another West African country would be more healthy and would be more kind of fair enough, to make sure that we are just and we are kind of fair in our comparison. Because to be honest, everyone knows the answer. I mean, I don't have to say the answer to you.
Oh,
I'll be confident.
well, if you say everyone knows the answer, that may not be a statement of fact. However, I have this to say. I've met with somebody that told me that physiotherapy practice in the UK is merely giving out sheets of paper with
Yeah,
inscriptions
I came
and
across this.
exercises,
Yeah, I came
and
across
they'll
this.
just read that to you and say, go and do these exercises at home, and that's all. Whereas in Nigeria, we have practical hands-on physiotherapy sessions.
Yeah, let me
And
just talk. Let me just talk on
Messi
that briefly.
argued
Yeah,
and said that he got, or he knew that in Nigeria they have fantastic results with physiotherapy practice compared to that of the UK. Do you agree with that?
yeah. I'll just talk on that briefly. I saw a kind of headline on the Daily Times of the UK some weeks ago talking about the physiotherapy practices being being a kind of fob on patients, on NHS patients, if you know what I mean. So people were reacting to that, and a lot of people said something very closely similar to what you've just mentioned about physiotherapy is not actually doing the manual skills, the manual therapy that they've been trained upon to do, and they just kind of dish out some form of exercises for patient to carry out. Like I mentioned to a patient yesterday, I'm still coming back to that, but even the exercises that we are talking about, we should also understand that exercise is medicine. What do I mean by this? Exercise must be structured, it must be planned, it must be dosage specific, and it must be time bound. So if you've got an exercise and it's not dosage specific, I'll probably say you are actually doing what is called an exercise abuse. Or for example, if you've got a lot of exercise packed like a jamboree together and you're doing them, you probably have what we call poly exercise or something very similar to polypharmacy, if you know what I mean. So I mean
Yeah.
this prescription of exercise is actually a whole systemic structural organization on its own, whereby it requires a trained qualified person to actually be able to determine a specific exercise that would resonate with the medical condition a patient has had. That being said, I will go back to the fact that the physiotherapists in the UK do not do more of hands-on treatment on patients. I would say, without being apologetic, this is kind of a false statement from the public, because I mean, if this is being said, we should be specific about the specialty of physiotherapy that does this, and not the physiotherapy as a whole. I'll give you a very good example. For example, in neurophysiotherapy, I mean, you agree with me. How do you want to treat? I mean, how is it reasonable for you to give someone who has had a stroke with paralysis of both the hand and the
Awesome.
leg a kind of exercise sheet,
Awesome.
and you just
Awesome.
say, go ahead and do your exercise? I mean, this is not reasonable even to the common sense. I mean,
Yeah.
this is something that people should know, that no, this is not true. I mean, the law of intervention. I must stress again, apart from the fact that physiotherapists uses they uses their manual therapy skills in the recovery or restoration of function of patient. They actually use some other means, in the intervention of patient recovery,
Very
talking about
correct.
physical modalities, talking about shockwave diathermy, talking about things like um, ultrasound, talking about injection guided ultrasound, talking about CPM, talking about gate education program, talking about electrotherapy. There are a lot of things that physiotherapist does
Awesome.
that
Awesome.
makes the
In
profession
fact,
the whole
I'm
autonomous
I'm
profession
happy
do
you
on its
I'm
own.
awesome. I'm happy that you are able to share light on this area.
Mm,
You just spoke. I also argued in this same line with the person, because some things we see in the public domain are just sensational stuff,
mm,
just to arouse the public against certain individual or group.
mm,
Like I said to the person, that perhaps that individual that was given a sheet of paper with a detailed exercise program, probably the person attended an A&E session,
yeah.
probably the person is mobile, and the person wants some form of exercises to strengthen the limbs or so, and was given a kind of prescriptive exercise programs
Mm.
on the sheet for the person to carry on, more like an own program that we do. So that should not be a general statement for the entire physiotherapy practice in the UK, because there are several different specialties.
Let me
Say for
just
instance,
let me just chip in respiratory. For example, say for instance,
exactly. That's where I was just about saying that
yeah.
that respiratory cardiothoracic. Will you say they give that person a sheet of paper to do exercises? No. So there's different specialties,
I
and
mean, part of just sorry, I'm sorry. Part of what we
yeah,
also do in neuro, I mean, as a neurophysiotherapist, is the care of patients who have had a neurological condition, say for example, stroke or tracheostomy. For example, I mean, how do you want to, practice something like what we call cough down trials or decannulation on the patient with tracheostomy, and you are talking of just a sheet of paper? I mean, that's not possible. You have to actually, use your hands-on skills to,
yeah,
talking about suctioning techniques, talking about, several things that you do to make the patient voice come back when after they've had the tracheostomy. I mean, these are just like you mentioned, they are public propagandas that are not actually
yeah,
true, because I mean, in
yeah,
the real sense, we know what we do, and we know those who will do them for, they know actually what they get from us. Yeah.
yeah. Very, very true. I will round up with the statement from uh my HOD when I was doing my internship program in University of Jos.
Hmm.
The HOD then was Dr. Hanue. He used to say something. He said, exercises are just like medications.
Hmm.
You wouldn't want to go into a pharmacy store and begin to take tablets and begin to swallow.
Mhm,
So that
exactly.
would amount to polypharmacy, just like you mentioned earlier on. So is exercise. You would not just see a bicycle ergometer stationed somewhere and you jump on it and begin to cycle. Like I said, it has to be measured. It has to have a dosage. It has to be prescribed to you.
Yeah.
So all these things make physiotherapy very, very interesting
I mean,
profession.
somebody might want to ask you, like, okay, just tell me what are the side effects of doing too much exercises. I'll tell you one
Yeah,
for free just tonight. I mean, and you take that home as a takeaway. I mean, there are lot of numerous hundreds of side effects to exercising so too much without prescription. A very good one I'll give you is what we call exertional rhabdomyolysis. If you actually go beyond what you can do, your muscles can tell you, Mr. Man, I'm dying right now and I'll die. So get your exercise prescription from a qualified physiotherapist. Thank you.
All right.
Yeah.
Thank you very much, Mr. Afolabi Wasiu.
It's been a
It's
pleasure.
a
Yeah.
pleasure to have you this evening,
Thank you
and
very much.
I hope to bring you back to this program where you will share some light to
Mm.
us and enlighten the public on some of the specific roles of physiotherapy in the economic development and other aspects that we hope to bring up live. Thank you once again. I really appreciate your time and your
It's
presence.
been a pleasure.
For
Yeah.
now,
Thank you very
I
much.
would say thank you and bye bye for now.
All right. Bye. Cheers.
All
Bye.
right, take care.
Yeah.
Bye.